Hey guys, you're welcome once again to my YouTube channel. It's your boy Dr. K, and I want to appreciate you guys for sticking with me so far. I want to appreciate you guys for your support. You know, it's been massive. I appreciate it. It's so heartwarming to see so many people supporting me, sharing my videos, watching and liking and putting in their comments. I really appreciate it. And if you haven't subscribed, make sure you hit that subscription button. And make sure you like my videos, share, because there's so much information in it. There's so much to learn from these videos. And put down your comments. If you have any topic you want me to talk about that you think we haven't done justice to, please feel free to put down your comment. You can also reach me on my Instagram at drkunle on my Instagram. Send me a DM. Let me know what you think. Let me know your thoughts. I'm open to criticism. You know, criticize me. Let me learn, and let's move forward. Thank you. Today's topic is going to be something very interesting. The last two topics I spoke about, heart attack and cardiac arrest, and you know, I said I was going to talk about the reason for heart attack. The major reason that heart attacks happen is what we call an increase in cholesterol level to a problematic point. We call it dyslipidemia. So today's topic is going to be about cholesterol. Let's get on with it. So what is cholesterol? You know, these are the things we're going to talk about. Cholesterol. We talk about where we can get cholesterol from in our diet, the types that we have, the good effects of bad cholesterol, and we'll talk about the bad effect of the good effect of the cholesterol, and we'll talk about the bad effect of cholesterol. We'll talk about the adverse effect, the symptoms you have if you have a high level of cholesterol, and then how we can manage it. First definition. So cholesterol is a waxy fat-like substance that your body needs for good health, but in the right amount. In a nutshell, means we all need cholesterol. We all need it, but it has to be in the right amount, because cholesterol is useful in production of hormones, in production of some vitamins and substances that help us digest our food properly. And also, it's also important to know that we can get cholesterol from different sources. Some of these main sources of cholesterol is from fatty food like milk, cheese. You know, you can get it from animal fat, you can get it from butter, you can get it from margarine. You know, it's for people who have a high cholesterol. When we get there, we'll talk about how to deal with a high cholesterol and your diet. And people who have low cholesterol, we'll talk about how to bring it up with these particular type of food. As I said earlier, milk and some full dairy products like cheese, margarine, and also animal fat are good sources of cholesterol. So let's quickly run into the types of cholesterol we have. So there are different types of cholesterol, but the major ones we talk about here, we call the high density lipoprotein, that's HDL, the low density lipoprotein, the LDL, and the triglycerides. These three have different functions, but I'm not going to go too medical into it. I'm just going to give you, you know, a brief summary, something that we can talk about and understand easily. Something that will bring in good understanding for us. That's how I'm going to do. So high density lipoprotein, we call it the good cholesterol. We call it the good cholesterol because if you have a high density lipoprotein in good quantity, it can reduce the risk of a heart attack. But on the other hand, the low density lipoprotein is the bad cholesterol, is the culprit when it comes to the cholesterol that will clog capillaries and clog arteries that cause damages to the organs. You know, so low density lipoprotein and triglycerides are the two types of cholesterol that you really don't want them to be high. You want them to be normal. You know, you want them to be normal. You want the high density lipoprotein to be high. In fact, I've rarely seen people who have high density lipoprotein that is too high. You know, usually not in the normal range. It is usually the low density lipoprotein and the triglyceride usually shoots up to the abnormal levels. So, what are the advantages? I mean, we can't say cholesterol is all bad. It's all bad. It's all bad. It will have its advantages. The advantages of cholesterol is one, it's a precursor to production of most steroids and sex hormones. So most of these male hormones, most of the sex hormones generally, and most of the steroids that are being produced in the body, it is produced from the cholesterol that the body has. And every body cell needs a small part of cholesterol to function. Everybody said, if you look at the, when we used to draw a cell, you know, in elementary biology, you know, there's this part of it that I call that the fatty part, you know, there's usually cholesterol. All the cells in the body need it in the right quantity, as I've said earlier. Also, you need cholesterol to produce vitamin D. Cholesterol is a huge precursor to production of vitamin D. I know vitamin D, as it, on its own, can be is useful for strong bones. It's also useful for the parathyroid hormones, the parathyroid gland. So when we talk, well, that's the good and that's the advantage of cholesterol. So let's now move to the disadvantage of cholesterol. In a nutshell, we call it dyslipidemia, and dyslipidemia only just means that there is an increased level of cholesterol that is of disadvantage to the body. So dyslipidemia increases the chances of clogged arteries, which we call atherosclerosis, and invariably increase the chances of heart attack, stroke, and other circulatory concerns, especially in smokers. So that's another thing. My previous videos, when I mentioned smoking, I said, oh, smoking doesn't have any benefit to the body. And I'm still repeating it now. Smoking does not have any benefit to the body. Either you vape, either you smoke marijuana, either you smoke cigarette. Smoking does not have any benefit to the body. And also, it's important to know that a high level of cholesterol is often related to obesity, as people who have a high body mass index, an unhealthy diet, and also lack of exercise. So note, it doesn't mean that because you are obese means you must have a high cholesterol. No, slim people can also have a high cholesterol. It's not only limited to not see one fat person say, oh, because you are obese, no, you have cholesterol. No, it doesn't really mean the person has a high cholesterol. We don't put it in that bracket that way. You know, also unhealthy diet too, eating burger, cheese all the time, you know, not having, and lack of exercise. I mean, this caps it all. You have a bad lifestyle and you also have a bad exercise style. I mean, that's the precursor to having a high level of bad cholesterol in your body. So when you have this bad cholesterol, what are the things that you can have? The symptoms. I've seen so many patients having some level of high cholesterol. But let me just give you some tips that you might not even have at the back of your mind. So one, some people will have loose stool. Some people will have poor appetite. Some people will experience some level of fatigue. After doing a little work, they start getting tired. It could be a sign that your cholesterol is high. Some people have depression. Some people have weight gain, you know, and some people have bumps in the corner of their eyes. Here they have this little growth in the corner of their eyes. It could be a sign of a high cholesterol. Of course, pain. Some people have pains in their joints or in their muscle area, you know, and that pain might just be the fact that the capillary supply in that area is not getting enough blood anymore. Maybe the capillary has already been blocked by cholesterol, so that's the reason why you might be having that pain. Also, goes without saying, a chest pain, which can be as a result of a heart attack, you know, can also be symptoms of a high cholesterol. So let's talk about some definite things. We call it atherosclerosis. Atherosclerosis is just big grammar. But look at it this way. Look at this to be the lumen of a blood vessel. Let's say this is an artery, and this center here is the lumen. You know, as the person's blood cholesterol increases, there are little deposits that happen in the innermost part of the lumen. You know, and then as this deposit increases over time, it reduces the space that is left for blood to flow from this place, from the blood vessel, to meet the organ that vessel is supplying. Most times it's the heart. It could also be the kidney. It could also be the brain. When blood is not getting to that area properly, due to the buildup of what we call atherosclerotic plaque or high cholesterol in that area, it will ultimately cause that person not to get enough blood to that area, to that organ. They will cause some organ damages. The commonest of the organ damages that it causes is a heart attack. You know, I said earlier in my video that heart attack is caused by build-up of cholesterol in the muscle, in the red blood, in the artery rather, pardon me, in the artery that supplies the heart. There's a build-up of cholesterol in the artery that supplies the heart, and then because the blood is not getting, the heart is not getting enough blood and oxygen as it is supposed to get, that area starts to die off gradually. It starts to die off gradually, and the person eventually suffers a heart attack. If it gets so bad, the person can suffer what we call a massive heart attack. You know, that's how bad it can really get. Symptoms, you know, can include tightness or pain in the chest. The pain can radiate to the neck, can radiate to the back, can radiate to the shoulder and to the arms. The person can have some fatigue, so the person can have some lightheadedness, and sometimes there's abnormal heartbeats. Of course, this person is also prone to having some level of anxiety attack at that moment. The other organ that is usually affected by atherosclerosis or a high cholesterol blocking the red blood cell, or blocking the artery rather, is the brain. And in the brain, it causes a stroke. Same pattern. Blood vessels supplying the brain, the lumen is clogged and blood is not getting to the brain. Then that part of the brain starts to die. That part of the brain starts to die, and that part of the brain starts to lose its function. So that is why the person will have a physical manifestation of that, of that thing happening in the brain, in the way of stroke. It's also important to know that there are two types of stroke. One of them is caused by this atherosclerosis. The other one is not caused by atherosclerosis, but the one we are talking about in this video is the type of stroke we call the ischemic stroke, that is caused by a blockage of the blood vessels supplying the brain by cholesterol. So how do we manage it? Now we've talked about the good one, talked about the bad one, talked about the advantage, talked about the side effects of high cholesterol. How do we manage it, which is the most important part? The first thing is diet. You heard me? Diet. I mean, there's almost nothing you do in this world if you don't get your diet right. I mean, the person is not going to get anything good from life, and that's the truth, you know. So your diet has to include a lot of vegetables, a lot of fruits, a lot of things that can help you lower cholesterol, like avocado. Some people like to take garlics. Some people like to take whole grain, as well as soya beans, walnuts, oats. They all play a huge part, you know, in helping you bring cholesterol down. They really help. I've seen them help a lot. Also, we talk about exercises. If you know your cholesterol is high, after adjusting your meals, you also need to do exercise. This is very important. You know, I'm a huge advocate of exercises, because even myself, since I started doing exercises actively, I have seen a huge transformation. I should put out my journey. I'll document my journey, and also let you guys share from it. I've had a huge, tremendous change in my life since I started doing exercise diligently. You know, I keep saying that, you know, 30 minutes a day is okay. 30 minutes a day, 5 days a week. Just be consistent. Just be consistent. And also, exercise is different from physical activity. If you run from here to the bus stop and run back, start panting, with the exercise, that is not exercise. That is physical activity. Exercise is timed. Exercise is continuous. Exercise is consistent, and exercise has an end goal. There's a reason why we are doing exercises. Apart from drugs, apart from diet, you should also use medication. There are some direct medications that are used to reduce cholesterol. Those drugs help to increase the metabolism of cholesterol in the body, and then tends to get them reduced. Also, there are some drugs that we use to help blood flow properly to all the end organs. We usually use these drugs in patients who we think are predisposed to having atherosclerosis, or are prone to having problems with cholesterol. You know, if you see a patient after taking history, you know, okay, this patient is likely to fall into the line of people who have cholesterol problems. But you check cholesterol is okay, you start giving them these, we call them vasodilators, drugs that help you to move blood properly into the organs of the body, and all through the whole part of the body. And now, having done this, I know you want to know, how do we prevent? Because prevention is better than cure in every way. Prevention is better than cure in every. So how do we prevent a high cholesterol? First thing, always know your numbers. Okay, so know your numbers. It's very important. These are the numbers. You know your blood pressure. Check your blood pressure. I usually say the best time to check your blood pressure is within the hour of waking up daily. Know your BMI. BMI is body mass index. It is calculated by using the weight divided by the square of the height in meters of the patient. Also, you measure your waist circumference. Your waist circumference is very important, especially male and female, especially some of our males who take the contents of the green bottle. You know what I'm saying? It's important to check your waist circumference. Also, know your cholesterol levels. Your low density lipoprotein is very important. Triglycerides also is very important. And it's also important to know to tell you that people who have a high cholesterol also stand risk of being diabetic. So it's also important to know your fasting blood sugar. That will be all for this video. Thank you so much. I want to hear your questions. Put it in the comment section. Like this video. Please help me share to as many as possible people that you know need this information, which I think is really everybody. Until I come your way next week or next time, have a wonderful day. Happy New Month. Bye for now.